Hi there, my name is Andrea Cuesta. I am submitting my video for the Quality Initiative for Nursing 4502, Nursing Leadership and Management. I currently work for the Metroplex Adventist Hospital here in Killeen, Texas. I am a nursery nurse, so I work in the nursery, newborn nursery, and the NICU there, and spoke with our director of maternal child health there on the unit, and was able to identify our newest quality initiative that we are working on, which is the incorporation of glucose gel to help our neonates manage hypoglycemia, which is really exciting. Our quality initiative is hoping to decrease the number of NICU admissions that happen on the unit post-delivery. So what we do after delivery is identify the babies that are obviously at risk for hypoglycemia, whether they be small for gestational age, large for gestational age, babies of gestational diabetics, type 1 diabetics, type 2 diabetics, or any other physiological reason that they would have an issue keeping their blood sugars up. So what we typically do is we are testing blood sugars at the 30-minute to 1-hour mark after the first feed. So we do adhere to the national standard of the golden hour at Metroplex. So after delivery, we, for the most part, when it is or can be done, we are doing skin to skin with mom. We are not removing baby from mom. We do vitals and everything right there on mom. We leave baby with mom for the first hour. We're also trying to get that first feed, preferably breastfeeding, within that first hour as well. That is especially important with our babies that are at risk for low blood sugar. So we do try to adhere to that as much as possible. So after that first feed, we are checking a blood glucose level at 30 minutes to an hour after that first one. And then at 45 minutes, if the blood sugar is 45 or less, we are initiating a refeed. And this is an attempt to, get baby's blood sugar over 45. So after that refeed, we are rechecking in 1 hour. If in 1 hour the blood sugar is not above 45, we are then admitting baby to the NICU. We have notified the provider. Provider is saying, yes, let's take baby into the NICU. We are separating baby from mom and dad, causing stress, inserting an IV, starting a dextrose infusion, and more importantly, again, separating mom and baby when it is most important for them to be bonding. What the goal of the initiative is obviously to reduce the number of NICU admissions, but we're hoping that the glucose gel provides an easier, faster, less invasive way of treating neonatal hypoglycemia, as well as resulting in less frequent separations of mom and baby. As I said, we do try and adhere to the golden hour. We try to leave baby with parents as much as humanly possible. The quality indicators that will be used to measure this initiative are obviously the number of NICU admissions that we have to treat neonatal hypoglycemia. We're hoping that the use of the glucose gel will be effective in obviously the lower intervention, avoidance of the NICU admission. The maternal child health leadership is really who is going to be responsible for the data collection. And because this is an internal quality improvement initiative, there are really no outside reporting agencies that are being used. But I know that, everybody has really been involved as far as, hospital leadership, the quality control team there at the hospital. Legal has been involved as well, the pediatric hospitalist, the pharmacist, I believe even the OB docs have weighed in on it as well. So nursing involvement, really, because we are the ones on the floor, caring for the patients, we're going to be responsible for, really implementing this policy, educating ourselves, educating each other, making sure that we are providing the correct dose of glucose gel. There is an algorithm that the pharmacy will use as far as the hypoglycemic treatment, and then utilizing the glucose gel appropriately, and then following that use of the glucose gel up with obviously another AccuCheck. As I said before, there has been, many different disciplines involved in the development of this policy. The pediatric hospitalists, pharmacy, nursing leadership, quality, and legal. Everybody had input, helped with research, helped with policy development. Nursery nurses, and then nursing leadership are going to be responsible for putting the policy or change into action, and then maintaining the practice, and sort of monitoring, how this is going, making sure that if changes need to be made, if there are any difficulties or challenges, that, those are followed up on. We also have lactation. They're another discipline that is there on the unit with us, and they are going to be very important. They provide mom with, valuable education about, adequate feedings, how much they should be getting, how often they should be getting it, and really helping us cement with mom, what baby needs as far as nutrition in order to, not even have an issue with blood sugar, which is what our main goal is to have baby feeding adequately enough to, not even have to worry about low blood sugar. So the budget that was allotted really is next to nothing. From what I have heard, the glucose gel that we are stocking in the Pyxis for use on the babies is even the big tubes, so there will be waste, since we're probably going to be using mLs within the baby's mouth, and apparently it is very cost effective, much more cost effective than an entire NICU admission, and all the supplies that are used within the NICU, IVs, tubing, bags of fluid, etc. So the policy now is going to be that we utilize the glucose gel when we refeed baby. So we've already gotten that initial low blood sugar of 45 or less. When we go to refeed baby, we are going to be going to the Pyxis and taking out glucose gel. It's going to be dosed by weight by the pharmacy for us. And we're going to draw up this amount of glucose gel, insert it in baby's buccal space, massage in, and then encourage the refeed. This is in hopes that along with the feeding, it will help to get baby's blood sugar up faster, so that when we recheck in an hour, we'll have no problems with it being, over 45, therefore reducing the need for the NICU admission. We will obviously still be notifying physician when we are needing to use the glucose gel, and documenting that. It will be on the MAR, it will be in other documentation, and that way it will make it easier for leadership to track the use and success or failure of the policy. Challenges to this quality initiative, obviously, we can't control parents. As much as we educate, sometimes it just, people are, parents are tired, baby is tired, low blood sugar also equals sleepy baby. Parents don't want to wake sleeping babies. Breastfeeding is difficult. Sometimes they don't do it long enough. So parents and feedings, adequate feedings are a challenge. Nursing as far as education and following policy and doing things that we need to do. Sometimes that can be a challenge as well, getting kind of everybody on board as far as the policy and the new changes. And then also with the providers, making sure that providers are giving babies enough time to maintain their sugar, and enough time to adequately raise their blood sugar so that we don't need to move to the NICU admission. Nursing will have to work to really cement. And as I mentioned, lactation, we really need to lean on each other as far as parental education, as far as feedings, and then make sure that, as far as nursing goes, that we're doing the research and using the glucose gel, as needed so that we can get a good measurement of, whether or not this initiative is working. The timeline for this, there was approximately 9 months of research and discussion, planning, policy development, within all of the disciplines that I have already spoken about, prior to implementing this policy. I know that the policy is pretty much written as of right now. It has not officially rolled out. I know we have started stocking the Pyxis with the glucose gel, so that's promising. And then we also did discuss it in the last staff meeting, with everybody and the nursing director. So it's getting ready to roll out, and the testing, or I guess data collection, will be going on for a minimum of 12 months. And it will be compared with last year's numbers of NICU admissions. So it will be compared with the same time frame last year, and then taking into consideration the percentage of births that become NICU admissions for the treatment of hypoglycemia. So that is our quality initiative, the management of neonatal hypoglycemia with the use of glucose gel. I hope I answered all of your questions, and hopefully this initiative will be a success, because it really is an important area to focus on. We need to keep babies with moms. Alrighty, thank you. Bye-bye.